It's October, and that means it is Breast Cancer Awareness Month. And did you know that every 3 minutes a woman is diagnosed with breast cancer in this country? And many of us have been educated about the importance of early detection in the fight against breast cancer. But what if you were 4 to 6 times more likely to get breast cancer and no one told you? Well, that's the reality for millions of women with dense breasts. Breast density is a significant risk factor for breast cancer. And here to explain why that is and what you need to know about your own breast cancer screening is radiologist Dr. Thoma Kolb, expert in breast cancer diagnosis in young, high-risk women, and Nancy Capello, founder of Are You Dense, Inc., as well as Joanne Pushkin, Director of Government Relations for Are You Dense Advocacy, Inc. Both of you are breast cancer survivors. So let's jump right into this. Dr. Kolb, what are dense breasts?
Dense breasts are breasts that have very limited amount or a small amount of fat in them. Basically, the breasts are composed of a percent of fat and glands and tissue that's necessary to produce milk and bring it towards the nipple.
Okay, so I want to take a look at these pictures. This is what dense versus less dense breasts look like in a mammogram, right?
That's correct. And on the left side, you see there's more of a grayish pattern. It really is quite darker than that in real time when we read mammograms. And all the way over on the right is a more white appearing breast. And so the problem with women with dense breasts in terms of detecting breast cancer is that breast cancers are generally white on a mammogram. They're almost always white on a mammogram. And so it would be much easier to find a breast cancer in a woman with a fatty breast, that is a dark background like the picture on the left, than it would be in a woman that has a dense breast or the picture on your right.
Nancy and Joanne, how did you both find out about your breast cancer?
Well, I was diagnosed in 2004 after my gynecologist felt a thickening in my right breast. Now, I had just had a mammogram, Stephanie. In fact, I ended up with 13 cancerous lymph nodes, and it was the first time when I was diagnosed with stage 3C breast cancer that I was informed that the reason why the mammogram did not find the cancer was because of my own dense breast tissue. I never heard of that until after my advanced cancer diagnosis.
You never had that information?
Never.
Was that the case for you, Joanne?
It's almost the same exact story. I mean, I was a wonderful patient, doing everything right, going for my exams, eating right, exercising, going for my mammograms, never missed an appointment. And one day during a self-exam, I felt the lump. Called my doctor, went in that day for the mammogram and the sonogram, and on the mammogram that day when I felt the lump, the tech did the exam, left the room, came back in and said, okay, you're all clear, you can leave now. And I just assumed she'd come back into the wrong room, and I said, oh, no, I'm the lady with the lump I can feel. And she said, oh no, you have dense breast tissue, that's going to be a very hard find for us. And I remember saying to her, wait, what? So the day I was diagnosed with breast cancer was the first time I heard that term.
It's the first time I've heard the term, Dr. Kolb. I mean, why aren't doctors informing women that dense breast tissue can affect the detection of cancer?
Well, let me just say that the density of the breast is in the report that goes to the referring physician. There is no mandate for us to tell women what their breast density is, but clearly the degree of density, how dense a woman's breast is, affects how well a mammogram works in detecting breast cancer.
Okay. Should women be told so that they can talk to their doctor about possibly doing additional screening?
Yes, I think it's very important for women to know their breast density because it affects the accuracy of the mammogram of the test. And I just have to make one point that the positive aspects of doing mammograms in terms of life saves are studies that were done in spite of all these dense breasts. So what we want to do is increase cancer detection above and beyond what we can do now. So when we talk about a mammogram having limitations in finding breast cancer in women with dense breasts, it's because we want to increase the amount of cancers detected above and beyond the amount of lives saved now by mammograms.
So part of what you ladies are doing are actually trying to make it law that women have this information.
Yes, that's exactly right, Stephanie. We really believe that it's critically important, even though the referring doctor and the radiologist will know about my own breast density and other women's breast density, the patient never finds that out for the most part. And that's why we really have started in Connecticut with standardizing the communication of breast density to the patient. It is critically important.
And both of you have been in remission, I assume, for a while?
I've had a recurrence this year. Dense-breasted women are also more likely to have a recurrence, and I've experienced that this year.
Well, you both look great. I wish you all of the best. Joanne, Nancy, Dr. Kolb, such an important issue that I knew nothing about. Thank you so much for talking to us about it.
Thank you, Stephanie.
Thank you.